The catalyst in developing the coordination hub was really to help facilitate flow of our patients right from the beginning of the journey in the emergency department all the way through to discharge, and to ensure that our patients receive care at the right time and in the right place.
The really great thing about the coordination hub is it allows us to see patients in a more effective and visible way. So we can transfer these patients to the next episode of care, be it in the community or into another hospital.
The coordination hub runs 24/7. We've got 2 monitors that monitor live news feeds from the community. We have closed circuit television that is monitoring the ambulance bays both here at GCUH and Robina hospitals, as well as the helipad at Gold Coast University Hospital.
Prior to the coordination hub, everything was done on paper, whiteboards. There were 10 hours of meetings held across the HHS talking about patient flow. By the time we got the information, it would be an hour old, and we had no visibility of what really was happening in our service.
The Gold Coast Hospital and Health Service Coordination Hub has a number of key players that are sitting within the Coordination Hub. We have Queensland Ambulance Service, we have Environmental Services, Allied Health, Integrated Care, as well as our bed managers, after hours coordinators and staffing managers.
There were a few barriers to moving patients through the hospital, and it could even come down to a bed being cleaned or to a wardsman being notified to go and collect a patient. You needed to have multiple phone calls just to make one of those actions happen. Whereas now we have environmental services in the hub. They can see when a patient is discharged, they can task someone straight away to go and clean that bed or move that patient.
It also provides us information around patients that may be complex or require extra care needs to effectively manage them through the healthcare system.
What the hub has done is suddenly everyone is able to see the whole of the patient journey across all the screens. I think what we realised very soon is the excitement that it caused within the hospital, and I think that's the one thing that I would say has come out of it that we never really appreciated, but it has caused a very positive shift in culture.
The Coordination Hub has really brought teams together. We no longer operate in silos. We're able to be more collaborative, better teamwork and better support for our colleagues that are managing patients at the coalface.
The amazing thing that I find with the Coordination Hub, it has brought the patient focus, patient care, to be the main focus within the organisation. It is pulling information across different areas into one area, but it's also bringing people together to work so that we can actually care for our patients as being the focus rather than actually having people as numbers.